AskReddit by Izzy Sparks. Doctors of Reddit, what happened when you diagnosed a COVID-19 denier with COVID-19? Not entirely related, but with visiting not allowed, we would make more of an effort to call families to update them. I was on an uncovered ward and updating a family member of an elderly patient. They asked about COVID swab results. I used my best reassuring tone to let them know they'd been negative so far and we were doing our best to keep it that way. His response was negative. Well, how about that? And he went on a rant about how it was all a hoax. Not a doctor, but an EMT. We got called for someone with difficulty breathing. Arrived on scene to find 87-year-old in tripod position, bad sign, with visibly labored respirations. Dispatch warned us of COVID symptoms, so I was in full PPE, gown, gloves, goggles, N95, and surgical mask. We assessed vitals and found her SpO2 was in the low 80s, very bad sign, with respirations of 28 BPM and bilateral rales and wheezing, also very bad sign. As I'm getting vitals, my partner is asking her some questions, while one of the trainees goes to ask her daughter for a history. PT spends the entire time yelling at us about how it's a hoax and tells me to take my fucking mask off. We refuse, and I tell her I need the mask for my protection and we actually need her to put one on. She says like hell I'm putting one on, but she's too weak to fight us, so we put on her anyway. She swears she does not have C. One story stands out. Last summer a guy came to the ED with symptoms and tested positive. He refused admission for the classic list of reasons. It's a complete hoax, and even if it's not a complete hoax, it's not that big a deal. I'm strong enough, etc. Couple days later he was back in the ED with his mom, who he lived with and who was now also symptomatic. They were both admitted and eventually put on ventilators. Guy lived, but his mom didn't. Dude killed his mom. I can't imagine how you live with that. Not a doctor but a respiratory therapist. We had a patient, mother of 3, on FaceTime with her boyfriend denying it was real right up to the moment we intubated her. Guess who ended up with a trash peg and never came off a ventilator till she died? The patient themselves understood and agreed to all treatment. Their son though, man. Calling us every single day to yell at us for testing the patient, telling us doctors that we were under the government's pocket, spreading lies sponsored by the CDC. The son even demanded us to print out the patient's entire medical record to prove how we were lying. Horrible to see the awful side of humans in this pandemic. Nurse here. I had COVID and now I'm in rehabilitation because my lungs are at 70% capacity now. I was at 40% capacity and now when I hear someone say that, I have the urge to slap them with a chair. I will need another year until I'm fully recovered. Edit. I thank you all the kind words and the awards. You guys gals are awesome. My wife's a nurse. Just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE like gowns, goggles, etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 15 minutes and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test. $4,800 extra for the anesthesiologist. As an anesthesiologist, by the time someone's calling for us it's for intubation and the patient is in no condition to deny anything. Honestly, it's usually the family that's the issue and that needs to be escorted from the room. That boggles my mind. By that point they can see that their loved one is having trouble breathing, and they are still trying to keep them from being treated. My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with care of fever and diarrhea. The child was severely dehydrated and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was the child never left the house. It's just I and the father who go to work daily. The grown mother babysits while we are away. How can he even get COVID without leaving the house? She had called her husband. He came with 10-15 relatives in a car. They broke a few chairs and then left with the baby. We just informed about the case to the COVID control center. A family full of clowns? That's the only explanation I can come up with. Not a doctor, but my wife is and a few of our family friends are as well. One of them is sports medicine family. The guy came in, refused to use a mask. Our friend refused to treat him until he masked up. He had a newborn at the time too. When our friend told him he most likely has COVID, he needs to go to Tampa General immediately for testing and treatment. The guy said no, it's fake, he just needed some antibiotics. He left without getting a prescription, called back that night, demanded to be given oxygen. Our friend told him his only option was to go to the hospital. Guy had a severe case of COVID and ended up being hospitalized for a few weeks. He still thinks it was fake and was only a severe flu. I wonder if the doctor would have diagnosed Wuhan flu, he would have complied better. They just kept denying they had it, stated they had something else, and tried to leave against medical advice while on high-flow nasal cannula, which we didn't let him do because he would have died within minutes. Before he was admitted to the hospital, he was symptomatic but refused to isolate at home. He gave it to his wife, who ended up in the ICU. I just don't understand what these people get out of saying it's something else. If it's something else, wouldn't that mean they believe there's something terrible out there anyway? IDK, it's stupid. I don't get it. I'm an anesthesiologist, and in our institution, we're the ones tasked with intubating COVID suspects positive patients who would otherwise die without ventilatory support. And holy hell, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to milch money off them. Some of them scream at us, in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. When was the stage of the Black Death where people said no, this isn't happening to anyone? This is a trick of the devil to make us think God has abandoned us. No one is actually sick at all. Are we just worse at scientific reasoning than 13th century peasants? I'm a student, funeral director, and I see families go to the funeral of someone who died of COVID-19 and still deny it. They started out shrieking at the doctors to change the cause of death on the death certificate. Now FEMA is helping with funeral expenses for covered deaths. Suddenly there's changes of heart. Physician here. The willful cognitive dissonance is real. It never ceases to amaze me how many patients will refuse assistance from me to register to get vaccinated, make claims that vaccines are harmful, but then accept my medical care on anything else that suits their whim. Patients absolutely have autonomy to refuse care, but why would you continue to see a physician and accept their medical advice and care if you think they would simultaneously recommend something to you that would be harmful? I've posed this question to patients who are vaccine hesitant. Why would you let me manage your diabetes and hypertension if you think I would harm you by recommending vaccinations? You cannot get any kind of thoughtful response aside from, I just don't want to be vaccinated. My mom works for an OBGYN who specializes in high-risk pregnancies and births, and he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth, but she insisted it was a hoax and ended up checking herself out AMA, but not before she spat in the face of the nurse, who coincidentally had just completed chemo. That was near the beginning of the pandemic, and I'm so curious what happened to that lady. The nurse is okay, thank goodness. That is at least assault, but possibly so much more depending on the outcome. RN here with most of 2020 spent in covered land. I never had anyone refuse treatment when things got serious. I know some of the MDs I worked with got yelled at, like the rest of us. but honestly that happens frequently anyway. Some Denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care. Imagine your last words are calling the guy trying to save your life a liar. Still had to treat her despite her accusing me of hiding the real diagnosis from her and doing something to make her sicker. Love my job. I can't fathom that people really believe that in a pandemic their likelihood of having COVID is so low that they accuse people of hiding a diagnosis. Makes no sense to me. Not a doctor, but when my grandmother was dying, my relatives kept pushing me and the doctors to say what it really was. It added so much stress to an already difficult situation and was embarrassing as well. Even after she died, they kept saying things like, "What if it was a stroke and she was misdiagnosed?" Don't you think they just didn't want to help her? I was trying to arrange with hospice to go in and say goodbye and my stupid second cousin was sending me YouTube videos about how COVID is fake. I was already not close with these people and I am glad they are out of my life now. People apparently take YouTube and social media very seriously, don't they? ER doc chiming in. They told me I was wrong. Obviously, there's no way they had COVID despite coming into the ER for shortness of breath, cough, and fevers. When I mentioned that their wife who was several rooms down also had COVID, their response was, "Oh, that makes sense because she always gets sick." When I asked how it made sense that they wouldn't have COVID with the same symptoms, I was told that it was because they were overall healthy and only took their mask off to eat and drink in the casino. As a casino worker, I can guarantee it was off the second they got past security. Not a doctor, but nurse that worked in one of our covered ICUs. Lady was intubated, sedated, proned. Therapy that involves lying the patient on their stomach in order to oxygenate the lung more effectively. Reserved for very sick covered patients, the whole shebang. Miraculously she recovers and is weaned down to high flow nasal cannula, still a fairly high oxygen requirement, but better than needing the breathing tube. This spiteful she-devil would purposely cough on us nurses as we went into her room to give meds care, simultaneously yelling that COVID isn't real, and that we gave her COVID. Deleted. I had a lady who was maxed out on high flow, next step is breathing tube, who still refused she had COVID and was holding a negative test in her hand that she had taken a week prior. The COVID equivalent of the Black Knight from Monty Python and the Holy Grail. Family members have come in with a sick family member and lied about exposure and or symptoms, despite a member's testing positive. This can lead to inappropriate management, delay in treatment, and exposure of staff and other families. The family members then get angry when told to isolate. Edit, typo. Reading some of these stories are wild. Even at the brink of death people still refuse that COVID is real or that they have it. They would rather believe anything else, almost to the point that I feel a doctor could tell them they are dying of AIDS or some made up disease and they go, "Oh see, I knew it wasn't COVID." Not a doctor but work in the psych area of the emergency department. Needless to say there's a lot of psychiatric illness based COVID denial and or paranoia. Patients often refuse swabs thinking we are trying to implant microchips. I only bring up my experience to contrast my psychiatrically unwell COVID denying patients to the psychologically unfit COVID denying population. One is because of brain chemical imbalances and the other due to propaganda, politicization, and poor critical thinking skills. It's interesting that the outcomes are similar, if only in this respect. Being someone suffering from a psychotic disorder not otherwise specified, this is exactly the kind of delusions I'm trying to avoid. It becomes such a paranoid rabbit hole to start asking what if when your mind is already wired to make connections no one else makes. There's still a part of me that indulges that paranoia. Coincidences are never coincidences. Conveniences and inconveniences are made on purpose. That sort of thing. and I have to ground myself every day to make sure those intrusive thoughts don't send me off the deep end. I dread to read up studies on the psychological psychiatric effect of COVID once it passes. I'm an ODP and work alongside anesthetists in theaters and ICU. To be honest, I've not really seen anything from patients regarding outright denial. However, I have seen some of my friends on Facebook who have spouted all sorts of lies. That's really disappointing to say the least. One of them, a friend of my wife, works at the hospital. She works in admin and refuses to wear a mask and even bought some certificate off the net so she doesn't have to wear one in public. Anyway, that's being escalated up the chain of disciplinary action. If you have such a bad respiratory issue that you can't wear a mask, then maybe you should stay home. I swear these people piss me off so bad. I hope she gets appropriate punishment for her refusal. Deleted. Medical spouse here. Husband works as a hospitalist in a rural hospital 1 week a month. He went to help in the ERBC. They had patient that needed to be tubed who was COVID positive but didn't believe in COVID. The patient's oxygen level got below 70% or 60%, or whatever severely hypoxic is, so they told him he needed to be intubated. The patient screamed at my husband that he was lying and that if he tubed him he'd sue. Husband asked if he could do it if the guy stopped breathing and the dude said, well, that's different. So he waited 15 minutes for him to pass out from lack of oxygen and then intubated him and walked out. Couple in their mid 60 years. Very rich. They came with all symptoms. Screaming COVID-19 don't exist. For them, it was a flu. Drink hot tea with lemon and honey at home. Some Advil for fever. Everything will be alright. Refuse to be hospitalized. Try to sue the hospital with their army of lawyers. It was in June 2020. They signed their papers. Go home. Come 2 days later on the hospital. Dead. Their son was in Japan. Never come to reclaim body. He just called to confirm the death of his parents. End of the story. That son knew what was up. Our neighbor was a COVID denier. So he wanted to prove that his healthy lifestyle of CrossFit would prove it is a bad cold. He now uses a mobility scooter to reach the mailbox, speaks like Stevie from Malcolm in the Middle, takes more pills than people twice his age, and can't taste or smell anything. Does he still CrossFit? Friend of mine was a COVID non-believer. Another close friend of ours had COVID bad and he gave him so much shit about not being online to game and hang out with us and just slept all day to recover. His own mother got it twice, but each time they were mild cases. I believe he said that the second time she got it she was sicker than the first time though. Then everyone including himself tested positive for COVID at his job. His was so bad it almost killed him. Found out he was diabetic too after his stay in the hospital. After he got out he's still apologizing to our friend every time he sees him about downplaying COVID. Edit. Looks like I missed a spot proofreading lol. Corrected part of a missing sentence. Doctor here. I was working in the COVID ICU as a resident physician. We were getting crushed with new patients and the ICUs were overflowing. I admitted this elderly gentleman around 2 AM with respiratory failure due to COVID. He was maintaining his oxygen saturation with high flow nasal cannula oxygen, but notably short of breath and unable to speak full sentences without gasping for air. At this point in the night I had been working about 22 hours into my 28-hour call shift. All I want to do is take a quick history and physical and get out of the room to reduce my exposure. He proceeds to tell me all about how COVID is a hoax and starts rambling on about some Bible passage. He even told me I needed to read the Bible more. I was beyond emotionally and physically drained by this point to respond to the audacity of his comments. He would later get intubated and spend a week on the ventilator. To say this pandemic made me cynical is an understatement. Deleted. I think it's way worse when the medical clinic is full of deniers. In my city a large and highly respected medical group was a hotbed of COVID cases last year. They all continued to work with active COVID and no masks. This is a medical group but the building has a restaurant, florist, plastic surgeons, and physical therapists along with the general or family practitioners. So put everyone at risk. Not a doctor, but worked as a 911 dispatcher for a few months when COVID was still new. I get a call from a lady claiming she found the cure for COVID and she just took it herself because she tested positive and was feeling much better. When I asked her what was the cure, she said half a cup of bleach and the other half red wine. As soon as she told me this, I sent an ambulance her way, but she refused to go to the hospital and kicked one of the paramedics. 5 hours later into my shift, I get a call from a young man claiming he just came from work and his mother is irresponsive. When I asked for the address, it was the same address the lady gave me earlier. The same paramedics went and confirmed her dead. Jesus Christ. Not a doctor but an EMT. Said patient had already been diagnosed and was being transferred to a different hospital. During the trip he kept insisting he wasn't sick and at one point even tried to rip off my respirator. So yeah, fun times. MD here still refused to wear a mask and self-isolate even after me explaining the risk to their family, the public. The next week his wife was in the ICU with guess what? Obligatory. Not me, I'm a key worker in retail, but a girl I work with is also a trainee nurse. One day she came in and seemed real upset, told us she'd had a female COVID positive patient lying in bed, on a ventilator, dying, and in her final moments her partner was shouting at her, "Stop being so dramatic, COVID isn't real, you just need to believe you'll get better." After she passed he started screaming at the doctors and nurses that they'd killed her, injected her with something, anything except believe the truth in front of him. Genuinely heartbreaking. Sometimes we still talk about that woman. I hope she found peace. I just want to thank all of the doctors, nurses and medical staff in this thread for not only continuing to work hard and risk your own health to help people, but also praise the fucking incredible patience you exercise dealing with such morons. The main thing I have learned from this pandemic is that if we ever have to face another one that is more deadly than COVID-19, we are royally fucked. I was telling my employee, who's a COVID denier, how my cousin's husband died of COVID unexpectedly. Her response was that they labeled it COVID but it was probably something else. Didn't know how to respond, so I just left. My roommate told me about a patient that refused to believe she had COVID even up to when they intubated her. She died a couple days later. Cognitive dissonance is a powerful drug. Just speculating, but I think the last minute denials were a form of self-preservation. At that point I don't think she could mentally handle that her own reckless behavior got her killed and that it was completely avoidable. I seem to have the opposite situation. Came down with some serious symptoms, cough, fever, aches, etc. in March of 2020, so emailed my doc about it thinking that I might have this new disease that is hitting the newswires. I didn't want to go in because of how contagious it was reported to be. He told me it was nothing to worry about and to drink fluids. I start feeling worse over the next 2 days and I find out someone I was near tested positive, so I reached out again with that info. Again was told that it wasn't serious, and he wouldn't test me. I asked him, out of an abundance of caution, how long I should quarantine, just to be safe, was easily able to work from home and had enough food to last a couple of weeks. His response to all of that was that it was highly unlikely that I had COVID and the motherfucker told me that I can go out in public whether I feel I want to. Later that year, I was curious and took an antibody test, which to no one's surprise said I was positive for antibodies. God knows how many other people had COVID that he wouldn't test and told them to go out into public. Not a doctor, but my youngest daughter is an RN at a busy medical center. She told me about a guy who had COVID, but kept denying it, even as his organs were shutting down. That was a super rough day for her. You're a liar. This virus is a hoax. I'll get your license pulled for this. They later died refusing their dying breath that COVID was a hoax. Edit. Yes, I still treated them. No, my license was not pulled. Gotta love this job. Edit. That's one of the tamer actions. I've gotten sworn at, flipped off, and nearly attacked. I had someone lunge at me. Gotta love this job at times. Edit. Thanks for the award, stranger. Edit. Thanks for the other award. My wife and I travel for work and she happens to work in medical labs, usually large hospitals. I've been shocked by the sheer amount of lab techs and the like who refuse to wear masks and nonchalantly go about life as if COVID weren't real. My sister is a microbiologist who works for a government research facility in FL where they do research into, yep, you guessed it, communicable diseases such as viruses. She managed to catch COVID at work from other idiots showing up maskless to work. Not everyone who works there is a scientist, but goddamn, you work for some place like say, the CDC, and even if you're just in maintenance, why wouldn't you take precautions? Because Florida, of course. She's looking at employment in another state now. Deleted. Hold up. Your aunt is 300 pounds but somehow didn't realize it until after she went to the hospital? A post I can participate in. I'm a resident. He insisted that this was a virus he got from someone who got their first dose of the Moderna vaccine. He kept removing his high-flow nasal cannula and desaturated to the low 80s, but I didn't argue too much, because when I went along with him he allowed me to treat him. So the entire stay we didn't discuss it, and the understanding was that he received the virus from viral shedding from a friend who was vaccinated. He believed it was a different virus that the government created. He was intubated on the 10th day and died on his 31st. RIP guy. Our daughter is a frontline nurse. She had one dying woman foxbutt screaming, between gasping for air, "Tell me what I really have. Tell me. I should know." You have COVID-19. COVID does not exist. It's fake and being used to control us. Tell me what I have. Mom, you have donkey brains. Had multiple patients go, "This is just the flu, I'll be better in a few days." Many of them died. Not a patient but had a family member demand to visit their son, a minor. We had to let them. Explained that they had COVID and wear protective equipment. They said they didn't need it because COVID doesn't exist. They were admitted 3 weeks later. Can't win with some people. I was a volunteer on the COVID ward. Loads of people who called it the China virus but they still took it seriously. Then I had one patient who didn't believe it when he was told he was positive, so he spit on me. So obviously I got it too, even though I was wearing all the protective clothing, but the guy was determined, and I got very sick and never went back. Edit. No, I didn't sue and I was never planning on it. I'm not in the US if that changes anything. Also, this happened months ago. Unfortunately, this is something that healthcare workers sometimes have to deal with. So please everyone, respect all our healthcare workers. Reading all these posts just confirms I don't have enough empathy and patience to work in that field. Edit. Wow, so this is what it's like when a comment blows up. LMAO. Thanks for letting me read y'all's responses. Yup, patients trying to pull off my PPE. Said patient would start to have other issues as well as COVID. But yeah, to many stupid people out there. I work in psych and the biggest issue has been people requesting letters stating they don't have to wear masks because of anxiety. I absolutely will not write such a letter, and the amount of times I have had to explain that not only to PT but to therapy staff who feel so bad for the PT is astronomical. I always give a detailed reason why, but I know no one is listening once they figure out my answer is no. Not a doctor by any measure, but my mom was a big COVID denier. Then she got COVID and her mind about the whole thing took a 180. Now she is vaccinated and educates her friends on dangers of COVID and why we all need to vaccinate.